want to welcome you today. We're KORT Physical Therapy, and just welcome to our Facebook Live today. I'm LauEWilliams, Physical Therapist and Clinic Director at our KORT Fountain location, and I have the opportunity today to have with me Dr. Kaveh Sajadi. He is orthopedic surgeon with Kentucky Bone and Joint Surgeons.
Thank you. I'm very happy and honored to be here today with you guys. We're neighbors in the building, and my practice is mostly orthopedics. I focus on shoulder and elbow surgery and sports medicine. There's 4 of us in this group. We have Dr. Andrew Ryan, who specializes in hip and knee replacement, Dr. Sam McCoy, who's a sports medicine specialist and knee specialist, and Dr. Daniel Hackett, who's also a shoulder and elbow surgeon like myself. We're here to serve most orthopedic needs and happy to serve.
And then we have today with us asking some questions, Chelsea Hartley. She is our Business Development Manager, and will be asking us some questions.
All right, this first question is for Dr. Sajadi. How do I know if I'm a candidate for surgery?
That's a great question, and certainly one we get frequently, and I would say it really depends on the specifics of the problem you're seeking treatment for. When it comes to the shoulder, I'll focus on the 2 most common problems that we see and ultimately treat. Number 1, rotator cuff problems. They're incredibly common. And rotator cuff tears are incredibly common as we get older and occur with or without injuries. If you've had an acute injury and have a tear, then you're probably a candidate for surgery in most cases, sooner rather than later. However, most tears are what we consider degenerative in nature. They kind of creep up on us over time. And in those cases, most of the time, it can be successfully treated non-surgically, predominantly with physical therapy. Studies have shown over 2/3 of people can be made well, not just better, but well with physical therapy. So if you've done that and unfortunately don't get better, then you may be a candidate for surgery. The other most common complaint we'll hear people come for is shoulder arthritis. That's a little bit different, and that is generally a degenerative problem. And surgery is absolutely a great option for that when it's affecting the quality of your life enough. And so that's a problem we try and maximize non-surgical measures such as medications, lifestyle adjustments, injections sometimes, and physical therapy. And when those measures no longer provide improvement in your pain and your quality of life is affected, then it may be time to discuss surgery. One of the characteristic features of both of those problems that will often drive people to the point of being ready to do something is nighttime pain. So if you're having a lot of nighttime pain in that shoulder and it's disturbing your sleep, it's probably time to seek some attention for that.
Awesome. All right, Laura, this question is for you. What can I be doing before surgery?
Okay, so at this point, you've probably, like Dr. Sajadi was saying, have had several conservative measures, and it may have helped for a time, it may have helped for a long time in a lot of cases. But if those have failed and you've been scheduled, you've decided, with your surgeon that you're going to have surgery, then the biggest thing is we've got some options for you to try to help maximize that. So one of the big things that we offer is a prehab visit. So essentially what that is once you're scheduled for surgery with their office, we'll take care of getting that set up. They'll get you they will get us your information, and then we can contact you for that. So what that session looks like is we're definitely going to take you through what to expect, kind of after the surgery and what to expect with your recovery. And a lot of it is to answer questions and to make sure that you feel comfortable and confident going in as much as we can before that surgery happens. And then that allows us to help, one, answer your questions, but also work closely with their office if there's other questions that you have or something doesn't sound right. That we need to make sure that we work out before surgery. But the biggest thing is to just increase your confidence in going into the surgery, and then increase the outcomes at the end. And we want to try to make sure we do this. And then one of the ways we do that is we do have a checklist, and this is something that we'll give you in that prehab session. And we'll go over a lot of tips, and we're going to touch on some of those here in a little bit, but go over a lot of tips on how to hopefully help make that, especially short term, right after surgery recovery, optimal, as well as the long term. And we have several different options for that now, so we're going to be able to see you in our clinic at this location right next door to their office. We're also going to be able to do a tele-rehab if that's a little bit easier for you, or if there is a barrier with travel. And then we could also do that in your home if needed, if that's appropriate. So we've got several options to make it easier for you.
Awesome. All right, this next question is for Dr. Sajadi. How soon will my PT start after surgery?
That will depend partly on the exact surgery you have and the specifications of your surgeon. There is some variability in it. In most cases, you will start some self-directed exercises that you will have been instructed by your surgeon and the therapist at your prehab visit that will help guide you on some of the simple things to begin the mobility process. But in most cases, physical therapy starts anywhere from 3 to 6 weeks after the surgery, and will commence for about 3 months or so after that to get your function maximized from the surgery. I would like to emphasize the importance of that prehab visit, particularly if you're having an outpatient surgery, in particular outpatient shoulder replacement. Everybody thinks they're prepared, they go in for it, and everything goes great, but sometimes it can feel a little overwhelming with the new information that's given. Having the prehab visit, as Laura said, brings confidence and gets you ready for that surgery.
So also directly after surgery, we offer a home visit within 48 hours of your discharge. So we find that this is also a very helpful way, again, to just make that process less overwhelming because you're getting a lot of information from a lot of different places. And then obviously the surgery itself, when you come home, things are different, obviously, than maybe you had anticipated. And we want to just make sure that we're able to give you 1 to 2 visits to, again, just review some of those self exercises that are appropriate for that stage of healing per the surgeon. But then also just make sure as far as your home and setup that you've got optimal safety and that way you can heal better and heal safer and make sure that we've got everything in place for you.
Okay, this next question is for Dr. Sajadi again. I've heard I have to wear a sling. How do I wear my sling and for how long?
That's a great question. This is probably, besides the initial surgical pain, the worst part of having shoulder surgery is having to be confined to a sling. In most cases, it's approximately 6 weeks. During that time, you will still be encouraged to begin some use of the hand, wrist, and elbow to minimize some of the stiffness that can occur from being in a sling. The sling is generally positioned with the idea of supporting the weight of the arm so that there's not such a direct pull on it, and to keep your arm in a more functional position with the elbow bent approximately 90 degrees. I think a misconception I see most patients is having their sling brought across their chest, and while that may seem a safer position, it actually can overly tighten some of the structures in the front of your shoulder. And so I prefer an optimal position with the arm in a resting position directly at your side. Sometimes a sling will also have a strap that wraps around your waist to provide a little bit additional support and stability.
Laura, this is for you. Is there anything I can do to prep my home before surgery?
Absolutely. So I think, when you do a prehab visit, that's a really kind of a big chunk of what we do. So there's several things that we can give you tips on for that. So some of that is making it a safe environment. So clearing throw rugs, clearing clutter, things that would cause you to trip. You don't want to fall anyway, but especially after you've had shoulder surgery. Make sure that you've got grab bars, non-skid mats in the shower. We also typically recommend a shower seat if you can, just because when you're first out of surgery, especially for the first week at least, your endurance is going to be really down too. So we want to make sure that you can shower safely when that's appropriate to do so. And then making sure that you bring things down to, kind of a counter level. So your medications, the things that you need on a common basis, you're going to want to have help at home, and that's really part of the criteria. And what we really encourage for healing at home initially is to have somebody there to help you. But as you start doing things, you want to make sure that even so, if you're having, shoulder surgery here, you want to make sure that you're not having to reach to extremes with the other arm, because that's going to just stress that a little bit too. So you want to make things as easy for you to reach and to get to the things that you need on a daily basis. We also typically recommend, a long handle shoehorn, long handle sponge, grabbing tool or reacher, in order to, again, make those things easy, because even though you're typically only going to have surgery on one side, you're going to want to make sure that you avoid anything that could potentially make it more difficult. And then night lights in the bathroom and hallways, again, that's a big safety measure that we don't often think about or always think about in order to just prevent a fall from happening. And then also, arranging someone to watch your pets. If you have pets at home, again, they are awesome, but oftentimes they can get under our feet and cause things a little bit unwanted. So there's a few other things that we will consider, but also probably the biggest thing that I give patients and that they ask me is, how do I sleep? And I think Dr. Sajadi probably gets that a lot too. And the sling does make it difficult. So, and you can add to this if you want, but a lot of times too, we recommend typically a recliner or something upright, especially at first. It's going to allow the shoulder to not be in a position where it's going to actually increase the swelling. It's also going to allow you to keep that optimal position that he was talking about, so you're not creating unwanted stresses in certain ways. And typically it's going to be the best way to get some sleep. So either in a recliner or something that kind of gives you a little bit of a more upright posture in those first few weeks, in order to be able to make sure that you heal well and that you get some sleep, as it's essential to recovery.
Absolutely. I echo that about being in a propped up position. The recliner is usually the easiest to get in and out of when you're in a sling, but you're not prohibited from getting in a bed. And if you can prop yourself up in a bed with lots of pillows in an easy fashion, that works quite well as well. You don't have to go get a recliner if you don't have one. And sometimes one of the pitfalls to a recliner is having some help, because the arm lever may be on the operative side, so you may have to have some help with workaround of that. But being propped up is really the key, and I think that helps people with their comfort in the initial week or so after surgery.
Okay, Dr. Sajadi, this one's for you. When will I be able to drive or return to work?
So that obviously will depend on a couple of factors. Number one, what kind of work you do, and number two, the driving in particular takes a secondary role to what medications you're taking. So the absolute hard and fast rule is no driving while you're taking narcotic pain medication. Secondary rule really falls into a advisement role. It's generally not advised that you drive while you're in a sling. Most of us have driven one-handed at one point in our lives, whether it's good or bad. One hand's on a coffee cup, one hand's changing the radio, one hand's holding the cell phone. It could be any or all of the above, but generally with a sling, you don't have the ability to rapidly adjust if you needed to. So it is a safety concern. And so if you have options, I prefer that you have someone else drive you during that period of time. As far as returning to work, that's also based partly on comfort and your activity level. If you have a desk job, mostly working in a computer or something along those lines, most people can return to work within 1 to 2 weeks. If you have a physical occupation that requires the use of that arm, unfortunately it may take as long as 3 to 6 months to return to that. But sometimes people can find that their employer will allow certain accommodations that allow them to return to work as soon as 6 to 8 weeks out from surgery.
All right, and Dr. Sajadi, how can I make an appointment with you?
Well, we're happy to take new appointments at any point. My office phone number is 859-276-5008, and you can find us on the internet at www.kyboneandjoint.com, and we're happy to see you.
Awesome. And Laura, how do I set up my physical therapy?
So as we mentioned before, we work really closely at KORT Fountain with Dr. Sajadi's office. So basically once the surgery is scheduled, we will receive your information and we'll reach out to you and essentially kind of take care of that part. So as always, you have options for where you do your physical therapy. We feel that this is one of the best ways, and we work closely with their office, so I think that there is definitely some benefit to that. And we also are able to schedule you not only at this location, but at any of our locations. So we can take care of that end. And then as we mentioned earlier, we've also got the 3 options. So we've got in-clinic options, we've got tele-rehab options, and then we've got home PT options. And we find that, of course, for patients that are local in Lexington, there may be less barriers for patients versus patients who are further away. So oftentimes that will be, you might want to go to a clinic obviously closer to your home, and that is fine. We can definitely help you with the prehab process and then getting you into one of those 3 avenues. So whether that be in clinic, tele-rehab, or a home PT. And typically those will work on a continuum. So at certain points in your recovery, you may be more appropriate. And then, of course, considering factors going on right now, we'll make sure that your safety is our priority right now. So we will make sure that we get you in the setting that is most appropriate, considering health factors, risk factors, comorbidities. And we want to make sure that we have options for that so that you can recover well, you can recover fully, you can recover safely after surgery. All right. Well, thank you guys for joining us today. We really appreciate having Dr. Sajadi on our Facebook Live, and we hope that you will give us a call. Our clinic at Fountain is 859-543-0060, or contact us at www.KORT.com.
Thank you.